Warm welcome to you to today's experience sharing session. Yes, we are here under the auspices of the full learning cycle of the Movement for Immunization Agenda 2030. We started on March 7, 2022 with 2 weeks of ideas and practice generation using the ideas engine. And then we later on had 4 weeks of situation analysis around a specific, your most important immunization challenge. And then we had 2 weeks of action planning. That's from the 9th to the 20th of May, the action planning hackathon. And throughout this while, we have been meeting 2 times every week for experience sharing. That's every Tuesdays and Thursdays to hear how you are doing and what you are doing to make a difference as far as immunization is concerned in your context. Right now, we are in the Impact Accelerator launch part for the IA2030 movement. And up till the 17th of June, you set a goal that you want to attain that will help you to take a step towards implementing the action plan that you've developed between the 19th and the 20th of May. And many of you signed up to participate in the Impact Accelerator. What is that participation concretely? It is basically you doing 2 things every week. The first is on Monday, you set a goal, an action that you need to complete by Friday. And if you have not yet set your action for this week, which is week 2 of the Impact Accelerator Launchpad, I'm inviting you to click on the link that I just shared in the chat and set your action right away, because we are going to be following up on you for that. And then secondly, every Friday, you tell us how your week went. If you were able to complete the action that you set for the week. If you are not able to complete, you still tell us what was the challenge. If you're able to complete, you can share your lessons learned and success stories with the rest of the group. And that is the link that I've just put up on the chat. So we know that this session is all about you doing the talking, François, myself, we doing the listening, and maybe asking a few questions for clarification. So before I turn towards our first participant who shared their experience today, I first of all like to say hello to Dr. François Gasse, whom we missed on Tuesday, but we are glad that he's with us here today. Hello, François, and how are you doing?
Bonjour. I say French and English, I'm confused now. Hi, Charlotte, and hello, everybody present today. I'm looking forward to hear your experience, your challenge in implementing your plan of action, the corrective measure, and the action steps that you have taken to reach your objective. So over to you, Charlotte, and eager to listen.
Thank you, François. And earlier on, we had Melese Teferi, who opted to share his own experience. Today, Melese, I'm asking you to unmute yourself. And when you do so, please do remind us who you are and where you're calling from and what you do. And you'll be telling us your challenge and the goal of your IA2030 action plan, the goal that you set for yourself that you need to attain by the 17th of June, 2022. And you tell us if you completed your week 1 action, what happened, how it turned out, and then what is your action for this week, and how will that action help you to achieve your goal? So over to you, Melese.
Thank you, Charlotte and Francos, to give me this opportunity to share my experience and learn from these huge professionals and the platform. So I'm Melese Teferi from Ethiopia, Addis Ababa. I'm a researcher in Armahansa Research Institute. I'm also a co-investigator for effectiveness study of COVID vaccine that's currently used in Ethiopia. And also I'm just coordinating different immunization-related activities in the Ministry of Health. So previously I was actually engaged many of my experience with immunization-related activities in the district as well as in the regional level. My challenge was actually high zero-dose children, or there are a huge disadvantaged populations in Ethiopia, especially in rural population, which is actually aggravated by the current pandemic, that's COVID-19. Especially at the beginning of this pandemic, there was actually huge frustration to the people that even they can't come or they can't bring their children to the healthcare facilities for different services. So this aggravate the high zero-dose children as well as high disadvantaged populations, especially rural populations. So this is my challenge actually. So my action plan actually focused on addressing this, at least 15% of the zero-dose children in the country within the next 2 years. So this is my goal actually, to address 15%, at least reduce by half that the available zero-dose children. To just give you some brief, Gavi reported that the zero-dose children in Ethiopia has increased throughout, but it's also aggravated by the pandemic. Yes, I just tried to complete my action, 1 week action plan. That was actually to identify key stakeholders as well as just introduce the objective or the goal of this integrated immunization service, and just convince them to work with us toward this high population of zero-dose children. But there is still a communication between some stakeholders, especially non-governmental organizations, that may be source of our funding to address this huge population. So in this week, I'm just working on the previously unaddressed plans, and also to organize my final plans that will be implemented for the next 2 years in collaboration with Ministry of Health staff, as well as healthcare providers in each level of the country. As well as I'm also just working to find additional non-governmental organizations that may be source of funding to just address this huge zero-dose children. Yeah, this is all what I have. Thank you.
Thank you very much, Melese. And if you have heard, Melese, the problem of zero-dose children and zero-dose communities is a common problem. So if you have heard Melese, you have any questions for him, go ahead and raise your hand to ask your question, or you can simply type your question in the chat. So, but while I'm waiting for you to raise your hands, Melese, I have maybe just a question for you. I see your goal is quite broad. You talked about addressing at least or reducing by half, that by 50%, zero-dose children in Ethiopia over the next 2 years. And if I heard you correctly, you said concretely last week, what you did was to try to identify key stakeholders to whom you are going to introduce the integrated immunization services approach. Correct me if I'm wrong, but what I did not get is your goal. What do you want to attain by the 17th of June?
Oh, yeah, by 17th of June, I already plan and share to have just the final draft of my plan that will be just approved by my stakeholders that will be engaged with us for working for the next 2 years to just address this objective.
Okay. Okay, and how many stakeholders were you able to identify last week?
Yeah, actually, there are also just some stakeholders that will be already identified, because I'm working in the Ministry of Health. So the Ministry of Health structures or healthcare structures that the officials, healthcare workers, as well as available structures and COVID-19 preventive teams are just volunteer to work with us to integrate the routine immunization with the COVID-19 prevention activities. But we are working with non-governmental organizations that may be the potential source of our financial issues that may be because it is outreach service that needs different logistical and financial resources, even though the human resource is already the available resource in the Ministry of Health. So we contacted and see their openness to work with us, two different organizations, that's Gavi, as well as
Unfortunately, you're breaking up.
In local non-governmental organizations. Sorry, can you hear me?
Yes, we can hear you now, Melese, but we are breaking up a little bit.
Maybe to summarize, yeah.
Okay, but I heard you when you reached the point of Gavi and some other local non-governmental organizations.
Yeah.
Okay. And do you have an idea of those localities, those locations where you have the highest number of zero-dose children? Because I'm sure if you want to reduce by 50% the next 2 years, you have to prioritize. So do you have an idea of where those priority areas are with zero-dose communities or communities with zero-dose children, with the highest number of zero-dose children?
Yeah, most commonly it's pastoralist populations that are not actually properly addressed by the Ministry of Health or the available healthcare structures. But still there is problems even in the town that have a huge population that needs these outreach services to integrate with COVID prevention activities, so that we have a lot of that missed their vaccination due to frustration of community and due to just overwhelming tasks of the healthcare providers due to COVID prevention. In the last 2 years.
Okay, thank you, Melese. François, while waiting for other participants in the room, maybe to share their own experiences or type their questions in the chat, do you have any questions for Melese?
Yes, for Melese, just to understand a little bit better, you're working on a plan of action, but you are at national level. So is this plan of action a special plan of action that you develop with the Ministry of Health and the partners, or are you with whom are you developing it? And then, of course, I heard that you're going to try to get an adhesion of all the partners to your plan. But my question is, how does this plan fit in the overall plan of immunization that you may be developing regularly and periodically? Is this a special plan of action outside of what you are doing in the country for immunization for COVID, or what is it? How is you position it, and who is working with you? Melese is out.
Melese, I see your mic is.
It's a plan to be implemented. Sorry.
Yeah, Melese, please come again. We're not hearing you.
Yeah, it's not actually a special plan that just will be implemented differently. It is part of the plan that it's part of the services that's given previously. It's part of actually outreach services, one of the services in Ethiopia that is implemented. Immunization gaps in different areas of the country, but the difference here is that integrating the COVID prevention activities with the previously or the routine healthcare activities that to use the resources at the same time. So it's not differently that is implemented program, but it will be part of the previous or the routine program, and to strengthen and use the resources that will be used for separately for COVID activities, and using the advantages to just address by minimized resources or minimized human resources as well as financial and logistic resources. It's not differently used.
Yeah. So yeah. Thank you. No, it's good. Thank you for your clarification. I was wondering, in your situation analysis that preceded your action plan, what was the root cause of the non-integration? Was it addressed and with some failures to integrate, as you mentioned, that mothers don't come? But what is the root cause of sort of a lack of integration between the two? What are the root causes you try to address by putting the two together? Is it prevention barriers? Is it education? What are you doing specifically?
Yeah, the root cause, why not integrated before? Is this a question? Yeah, actually, when the pandemic is just introduced in Ethiopia, everybody was panic enough, and it's not well organized, even they're doing the activities to address the problem. So it is just not a well organized prevention and control activities that may be integrated with, that was not actually integrated with the routine activities. Even other routine healthcare activities was just and just move for resources, human resources, logistics to the prevention, COVID prevention. So it was actually not well organized, well planned, and just integrated with activities that's already done before.
Okay, thank you.
Okay, thank you, François. Thank you, Melese. There's a question in the chat from Abdikani Hassan. I'm sure I'll just ask the question, but I'm sure you, in one of the questions François asked you, kind of like responded. But Abdikani, if you don't get support from stakeholders, what is your plan? So it's kind of like asking, do you have a plan B? If the stakeholders are not able to fund the project, do you have a plan B? What is your plan? Do you have an alternative plan?
Yeah.
But I know you talk about it. Yes, please go ahead.
We are going to actually to use available resources and structures, the Ministry of Health structures to just the financial and logistic prevention activities. But still, we need additional resources that maybe additional sources from different funding organizations. But if we don't have any funding organizations that maybe for fulfillment of this action plan, it is not actually just dependent on the new funding that will be just sourced from different sourcing organizations, but we need the current available structure and the budget that used for COVID-19 prevention to integrate the routine activities with the prevention activities. Yeah.
Okay, thank you so much, Melese. I'm sure you have answered Kani's question. Thank you once again for volunteering to share your experience, and we are really looking forward to coming back to you in the future to find out how far you've gone, you know, how many zero dose children you have been able to to meet up with, and what are the strategies, because especially the strategies that you're going to use to catch up those zero those children, as well as, and I'm sure even incompletely immunized children will also take benefit from this. Okay, so right now we have session. We can listen to one more experience. So please go ahead and raise your hand if you like to tell us how you are doing, to share your experience with the rest of the group. This session is all about experience sharing. So please raise your hand if you like to, share your experience with us.
Ndaeyo rest. Ndaeyo raised his hand.
Okay, hand is raised.
Ndaeyo should unmute herself or himself.
Okay. Dr. Ndaeyo, are you able to unmute yourself? Are you able to speak today? I'm asking you to unmute. This one is a special request from François. So I hope you're able to unmute yourself. Yeah, I see your hand is raised. I'm asking you to unmute.
Okay, thank you, Charlotte. Thank you, co-host. I'm Dr. Ndaeyo Iwot, Abuja, Nigeria. I've been on immunization programming at all levels, operations, planning, and coordination for over 25 years. And I'm one of the pioneers scholars with the Geneva Learning Foundation, and I'm on the movement of IA2030. This exercise, I'm now on my second week, and I'm having a challenge on human resource. The goal for June 17th for me is how to improve access to immunization and primary care services with improve human resource for health. Abuja Area Council that has achieved just 80% of the required minimum staffing for operations. And for week one, since I've identified the source of funding, there's a basic healthcare provision fund that is derived from 1% statutory consolidated revenue to the federation that is given to fund directly primary healthcare in Nigeria. So that funding, 5% of what is accruing to the state, is plowed into human resource. So that funding is guaranteed that the state will have 25% of the total cost of the activity, and the national will give 25%. And based on this, we have got to be very clear on the human resource gap at the implementing facilities. So what I did last week was to bring up the gap, and then this week and I achieved that. I had all the gaps in place from the 10 facilities implementing in the Abuja Area Council. So this week we are physically validating this, and as I'm speaking to you now, I'm in the field. Today is the last day. I validated 9, remaining 1. That is the 10th one is where I am now. Physical verification of the gap. So by Friday, tomorrow, I should have the validated list, so that by next week, that list should be with the FCT, that is the Federal Capital Territory Administration, for onwards processing towards approval. Because by 17th of June, I expect that the national should approve the FCT plan to absorb volunteers to bridge the human resource gap. So that is where I am for now, and things are moving fine. I'm working with civil society, coalition of civil society in Federal Capital Territory of Nigeria. I'm working with the Federal Ministry, FCT, Primary Health Care Board, the Coordinating Authority for Primary Health Care and Immunization processes in FTT. I'm also working with the coordinator of WHO FTT office and coordinator of National Private Development Agency FTT office. And we are working together very, very importantly. And I want to also quickly add here that I'm also on the I'm also on the supporting programming of responsive feedback, and I'm also taking the task that has been given, the assignments, the daily assignments from the programming, and it's helping me a lot. As I speak to you, I've identified my stakeholders, which I've already sort of engaged them. I've identified my resources. I'm on the learning questioning. Then to there, we are going to look at how we can apply the stop and reflect to ensure that my plan is very responsive and will lead to actualization or realization of my target on 17th of June. Thank you so much. I want to pause here and allow all of us to reflect. Over and out from my side.
Thank you very much, Dr. Ndaeyo, and for that clear explanation of how you are doing with implementation. Now, if you have listened to Ndaeyo, I'll go ahead and, okay, there is a question already in the chat from Haruna Mohammed. Said, do you have any plan for donor agencies to support your work? Let me just ask you that question.
Thank you very much for that question. The human resource gap resolution has been a problem for so many years, for over 30 years in FTT. And we have tried everything. We realize that donor agencies do not fund routine staff stipends or salaries. They prefer to fund some activities, some tasks, and then give you commodity. So the responsibility of stipend and salaries dwells with government. So since I found the window of the Basic Provision Fund, which is having a deliberate government policy that 5% of available funding from the Federation account should be used for human resource gap fulfillment, and then had to use, because I believe that with that I would not have issues with funding. So that is why I've approached the donor agencies for funding of staff immunization and salary for routine immunization and primary care activities. Beyond and over the supplemental activities that they are actually giving us support. But my contributions in the area of my logistics, in terms of airtime, transport, fueling of vehicles, and yes, that is the area that I'm having support. I'm also using my personal funds, and I have no problem at all doing that. Thank you so much.
Thanks again, Dr. Ndaeyo, François. And there is a comment from Samuel Jacques before François takes over. He says, please, I wish to express my profound gratitude to the last presenter. But how do you cope with implementation within your timeline? So, Samuel, I don't know if you're able to, I'm going to invite you to unmute yourself so that you be clear. You're talking about, I don't know whether you're talking about Melese or you're talking about Ndaeyo. So, Samuel, are you able to unmute? Samuel, okay, probably you're not able to unmute. So I'll turn towards François.
Thank you, Charlotte, and thank you, Ndaeyo, for presenting your challenge and how you moving towards meeting your objectives. I was impressed that you intend to achieve 80%. Reach 80% of your human resource gap within 2 years. Now, my first congratulations to try to be together and to have run this first step, which is essential to identify the human resource gap. My first question is that when you identify the resource gap, is it based on a reference of human resource ratio per population? Do you have a reference from the Federal Ministry of Health on what is an acceptable gap that you can stress when you talk to the ministry? Is it based on the reference of the ratio of population, or you have sort of reference sheet that tells you how you have identified these gaps? My second question to you is, of course, it's a dream to achieve 80%. The 1% budget allocated to, is it not used? Is it every year an additional 1%? And is it sufficient to cover the gap? And if not, how do you prioritize allocation of staffs that you may still receive money for? Over to you, Ndaeyo.
Thank you so much. Wonderful questions. And I want to say quickly that in Nigeria, we have the minimum standard for primary healthcare implementation, and the 3 types of primary healthcare facilities. That is the health post type 1, the primary healthcare clinic type 2, the primary healthcare center type 3. The health post is taking care of a population of less than of about 500 people. The health clinic is taking care of population of over 2,000 people. Then the health center, population of over 5,000, and the staffing of this kind of facilities, no matter where they are located, because we're also having issues in distribution and location of the various types of the facilities in the country, political determinants of location of facilities have turned the whole exercise into an inequitable exercise. So you are seeing us having over 250 private care facilities, but only 112, only 124 out of this are strategically located based on the population concentration. So, however, for basic care proportion fund, that the 1% allocation from the revenue from accruing to the federal government, it is a pilot approach that for a political board, for a political district, one primary care center that is like a referral center is equipped to a minimum standard, and the minimum standard is defined by a national document that was produced by the National Primary Care Agency with partners, donor agencies at that level of accessibility, with input from the state coordinators and the operators at the sub-national level. So based on this, we determine the number of people to do essential services, number of midwives to take delivery, and we also have people that should be having clinic-based activities and the community-based activities, home visits and outreach. So this will now give you the minimum number and mix of staff that you require to operate a facility. So it is this standard, is this checklist I'm using now to validate the physical validation of the available staff. So for instance, the facility that I'm in now, we are expected to have 19 personnel of various cadre. So what I'm having here in front of me, they are just 6. That means there's already a gap by number of about 13.
Ndaeyo, if I can interrupt, thank you, and I'm glad that this is based on an official reference material, and it's very good. Now, my next follow-up question is, is of course you will try to get part of the 1% to cover the gap, but how are you going to prioritize if you don't get enough resources? Does your plan of action, including a prioritization A, B, C based on the resource that you can mobilize?
Yes, thank you very much. I've already prioritized. What we require, the number of facilities that do not have enough staff, we are having 45 primary care facilities in Abuja. Only 30% of this have enough staff. So we are having about 35 or 36 that do not have enough staff. Out of these 35, 36, I'm taking those 10. I've only prioritized so that Now, however, this represents 1 per ward. So for a whole population ward that will take care of about at least 5,000 population, I will have a functional primary care center that will be able to cater for their needs. So they have to be properly staffed, be resourced and equipped for action. So with this prioritization I've already done in my programming, I'm very sure that looking at the past year allocation that was derived from this source of funding, the same number will be adequately funded. Yes. Thank you.
Thank you. Over to you,
Okay. Thank you, François. Thank you, Dr. Ndaeyo Iwot. We have a question in the chat from Melese, but Melese, I'm sure you're able to unmute yourself, so you can go ahead and unmute so that you ask your question directly to Dr. Ndaeyo, hoping that your connectivity holds up. Over to you, Melese.
Thank you, Charlotte. I'm just to share my understanding and some questions with the presentation, Dr. Swan. Thank you for your presentation. That's really good, and thank you for your commitment to just achieve 80% of your weekly as well as 17 days activities. Your challenge in plan, you said that the challenge is low human resource related to the population available in the country. But is there any evidence that shows the demand of the demand for immunization affected by the lack of professionals that give service, especially in the healthcare services, and any immunization service that's organized in different setups, for example, outreach. So is there any evidence that shows immunization gaps due to lack of human resource? And is there any demand and just service difference between?
Dr. Ndaeyo?
Yes, thank you so much. Absolutely. That is why I'm just giving summary. My evidence is already in my submission, including data from the district health information system. I've posted that along with my attachment to my submission, my initial submission. Yes, apart from supplemental activities that we are having team approach, that we are forming extra house-to-house team, that we are forming the micro plan is updated. We still have communities that are not covered at the end of the day inside. So in these services, it is worse when there is only one personnel taking charge of a ward that is having 5 private care facilities without staff. Is the only one that is going out there to stand in and provide services. So mothers do not even care to visit the facilities again. So it is mainly during supplemental activities when we recruit volunteers that we expand the reach and we improve on the situation. So this also affects the DHIS, the disease local endemic disease treatment in the area routinely. It also affects. You see low reporters, low patronage because the facilities are empty. So when we are having campaigns and we put in volunteers in those facilities, you see the uptake will so much increase and the daily conditions. So the data forms that I posted with my plans are very self-explanatory. Apart from my analysis based on staffing gaps, you could also see where availability of minimum service package are demonstrated that people are not subsidizing services in those citizens. Thank you.
Thank you once again, Dr. Ndaeyo Iwot, for sharing your experience with us, what you're already currently doing to tackle the challenge of human resources for health in some local government areas in the Federal Capital Territory, Abuja, Nigeria. And I'm sure in the coming weeks, we'll definitely be coming back to you to find out how everything is turning out. But remember that tomorrow, don't forget to tell us how you are doing, how your week went. And I'm glad you said you are actually on the field working on your action for the week. So if you are also working on your action for the week, like Dr. Iwot, do remember to tell us how your week went by clicking on the link that I just shared in the chat. You'll share that with us tomorrow. And we are very much interested in knowing what lessons you are learning, the challenges you are facing, or the success stories that you have recorded. And if there is no other hand raised, no other question, I think we are going to wrap up today's session. And I just want to also inform us that the Ideas Engine remains accessible to members of the movement who want to enrich themselves with ideas and practices that others are using elsewhere to solve their immunization challenges. If you are in implementation and you still have doubts as to how to go about your action plan, you can always visit the Ideas Engine to see ideas and practices that could be helpful to you. And remember that we are here to support one another. Do not suffer in silence. If you need any help, our IA2030 Telegram channel is there. And I know that there are members of the movement who are always ready to volunteer to support you. And next is a lot of people today complained about connectivity, and it's always the case in most of our sessions. So if you miss part of the session or you miss any session, you can always listen to the podcast that's like a radio in demand. So if you have not yet subscribed, go ahead, click on the link in the chat to subscribe to the podcast. And while you are going about, maybe on your way to the field, in the car, you can always listen to, instead of listening maybe to other programs or to music, you can listen to sessions, previous experience sharing sessions that will keep you abreast with what is happening in the movement. And remember, our next date for experience sharing is next Tuesday at 5 p.m. Geneva time. So you can also just register right now for our next experience sharing session with Dr. François Gasse and myself. That's next Tuesday at 5 p.m. Geneva time. So I am going to turn towards François Gasse for the key takeaways and the closing remarks for today's experience sharing session.
Thank you. My first point is thank you for those the presenters and the feedback and the questioning that we got. I think the presenter presented two critical ideas, challenge to address. The first one was to integrate better COVID and routine immunization, knowing that all the side effects of COVID immunization focus on COVID that has impacted on routine immunization in so many countries. So I think it's a very important objective to develop a plan and to do based, as it was mentioned, on the cause of no integration, of the cause of no use of routine immunization services because of COVID. The extreme focus, the massive allocation of money on COVAX has made the routine immunization suffer. So, and I think we heard a message that it's a kind of togetherness that we'll have a chance to address the issue. And I'm very happy to hear how much there is a togetherness in developing the plans and getting it endorsed with all the key stakeholders. The second one is, of course, another major issue that affect many countries, human resource gaps and how to address it. And I think it was very specific from Ndaeyo, whose first step was to identify the gaps using reference material standards from the Ministry of Health and reviewing all the gaps. And the first step was to identify the gap before presenting it to a potential, an agreement and a potential source of funding by the 1% allocated every year for human resources. And he really showed evidence of the gap with the presence of volunteers in health facility that could affect, outreach activity, supplementary immunization where they need to recruit a lot of volunteers, which is the case anyway because it's a temporary activity, but the routine delivery of services suffers from lack of staff and the need to prioritize because sometimes we don't get all the money we need to cover those funding gaps. So thank you very much for presenting and looking forward to see the next actions and expectively the object that you meet the objective. Thank you very much, Charlotte, and thank you to all of you.
Thank you, François, and thanks again to Dr. Ndaeyo Iwot and to Melese Teferi. I just put up an announcement in the chat that was already on Telegram. In 15 minutes time, we'll be having a lightning chat with Heidi Larson. Heidi Larson is the director of the Vaccine Confidence Project, and we'll be talking today about confidence in COVID-19 vaccination. So it is in exactly 15 minutes time. And I'm just sharing with you again the Zoom link in the chat. IA2030 movement members and teach-to-reach participants are invited to join the session in the Zoom studio that will be broadcast live on our social media platform. So you can join and you can have the opportunity to ask your question to Dr. Heidi Larson. So please go ahead and when the time comes, take note of the link. The announcement is also on Telegram. I can just put up the link to the Telegram announcement as well, so that if you miss what I've posted in the chat, you can take the link. You can go to the link directly to see to see the Zoom link or the other social media link, that's Facebook, YouTube, and LinkedIn, if you have bandwidth issues and would like to join via those various media. So thanks again to everyone, and look forward to seeing you on Monday for the Global Assembly and on Tuesday for another experience sharing session. But I hope you'll be in the Zoom room in exactly in about 13 minutes for the lightning chat. Wish you an excellent day, a great weekend, and see you next time. Bye.
Thank you, Charlotte, and all of you.
Thank you.
So who are the
Bye.